I need to take a closer look to your scalp now.
Sure.
Okay, so I mean your scalp is dry. So I will update you about your donor situation after we shave everything.
Okay.
Your crown area is not that patch is not very large. In following years, those patch might get a bit larger. Those outer zone of the graft hairs are completely intact and like they are thick right now. Would you think about to give another chance to finasteride after the surgery?
Which one do you recommend overall?
The tablet is way effective. Yeah, they also produce tablets.
Okay. The topicals aren't as many side effects, or?
Yeah, they don't have as side effects.
Okay.
Like,
Yeah.
so let's talk about the hairline.
Like, I don't necessarily want to go like super low or anything. Like, I kind of want to keep it natural to my face.
I will start from the middle, but when I go to sides, I will gradually go upwards. I cannot go straight across.
Yeah.
It will not look good.
Yeah.
And when I do the implantation, we have to make some irregularities on the line.
Yeah.
It cannot be in order. It cannot be too perfect.
Yeah, of course.
In the same level, every graft, it will look bad, even if we make the gradual upwarding.
Yeah.
So you will be careful about this. No worries.
Yes.
Can you raise your eyebrows, please? Maximally, yeah. I'm going to create something and let's talk about on it. Okay.
Yeah, I think that's good. I wouldn't have gone like too low anyway. So
Yeah, I think you'll be happy with that. You're using mullets for a long time.
yeah.
Let's prepare you for the surgery.
Now they're going to check your blood pressure.
Oh no.
Oh.
Shaving my hair.
Check for any possible disease, STDs kind of disease. When we see them negative, then let's shave your head.
Okay.
Your skull shape is good.
Yeah, what is good so far?
I don't know what's happening. So.
You see that like patches, small patches here?
Yeah.
Yeah, they scanned everywhere. Probably they use a little bit larger punch,
Okay.
so the scars are more visible. We can harvest enough numbers still, but we have to be more careful. That's all. The injection parts. I want to talk about Jason's extraction a little bit. So we planned safe maximum extraction for his case. His donoria has been extracted before. We have to be extra careful with the extraction. Aimed for 4,000 grafts, and we strongly believe that that number will be perfectly enough to cover everything with a very good density.
So how was the procedure for now?
So far, so good. Can't like feel anything, so comfortable until now.
So we are going to start with the implantation right now. It will take roughly 2 hours. On the frontal layer, I created 3,200 incisions. So the vast majority of the grafts will go to the front. And 900 grafts will go to the central crown. We are going to see the Jason one more time. We have to see him the next day after the surgery to make sure everything is okay. So we are going to check him, and so we will give him the education he needs for the aftercare, because the surgery is important, yes, but the aftercare matters. We will be checking on him for this 1 year healing process.